Yeah.
Good afternoon. Hello, I am Dr. Sharyl Truty, owner of Balanced Physician Care, and welcome to our noon lunch hour health talk, where we talk about topics that serve you and the community. I'm here today with one of my favorite people, Carol C.C. Miller. She is a positivity coach and also founder of a fantastic nonprofit called Positive Focus. She writes blogs and coaches quite a bit on helping people just live their best lives for themselves. She certainly helped me a lot and several patients, so it's always great to have her here to talk. Welcome, Carol, today.
Thanks for having me. I always love our chats.
Yeah, so today our talk is going to be about anti-aging and positivity. So, it seems a little bit, of an unusual sort of topic. You think, being positive, can that really lead to longevity in our health? And the answer seems to be yes.
Yeah, you had just sent a really interesting article about the studies of, what was it, a Harvard study for 75 years on a large group of people. And it talks about your thoughts and connection with other people. But it's truly, like what I always tell people is I'm here to heighten celebrations and lessen sorrows through a positive focus. Things go on in our lives that we don't have control over. But when we work with it with appreciation and moving through it, then we're going to move through those challenges a lot easier too. So having a positive mindset and being focused on appreciation is absolutely going to help you move through life, and you're going to feel better and you're going to look better just because of your attitude about it.
Absolutely. And part of, I think, that positivity, to sort of weave in the study a little bit, is about, relationships and how those relationships themselves can be very supportive. The studies show that there's 50% increased survival in patients who have stronger relationships. And some of the reasons for this, statistic are that, when, unexpected life things tend to happen, having that, social connection helps us to process, these traumas better. And it helps to bring joy and love into our life. And that, for us as human beings, is linked to just better improved survival and health sort of outcomes, in a sense.
I agree completely. And what I found interesting about the article, and obviously you can't capture everything in an article, but what they did talk about was those connected relationships and the importance. But they did not mention, like, you can have a deep, close relationships where you complain, blame, and shame all the time. So I don't know that kind of connection is necessarily going to help you in later years, kind of thing. But it is when when you're going through something and you could call a good friend of yours to help you through it, or your loved one or husband or wife or your partner in life, and you know that somebody's going to be there to walk with you through it, it absolutely makes it easier to do. So I would also add people who are going to see the best in the situation rather than join you in worry, because it's easy to worry about when, especially in the work you do, when you have to tell a patient, you're giving them a hard diagnosis, and who doesn't step into the worst case scenario right away? You feel your way through it, and then you work towards feeling a little bit better step by step.
Yes, and I mean, the studies do, go to point out, like you said, they talk about supportive relationships.
Yeah.
Relationships that are built on giving and gratitude. And, I think those are the foundations of positivity that you and I, talk about frequently in our conversations. And so, and I think, we talk a lot about family, but family isn't necessarily always, your genetic relations. For some people, family, can be a group. of people, and they may, a lot of times they're united by common interests, whether that's, church or religion, whether that is, a social connection, an ethnic, cultural, background connection, whether that's a professional connection that, might be at heart, but then it grows into something deeper. I think that those social relationships are really positive relationships that people develop and can come from a variety of different places.
Right. Or even if you're dealing with a challenge, the support groups around those challenges. So you can even find and build your community in that moment too, if you don't have close relationships to help walk you through it.
Yeah. Yeah. And like you said, it's interesting, the foundation, of the social, groups that seem to be, associated with improving longevity and health, again, have those core positivity, concepts that we talk about. And, interestingly, that gratitude, concept, comes back, sort of into play. And, how often we sometimes lose that, I think sometimes in a part of the challenges that we're facing daily.
I think it's very easy to lose gratitude. Gratitude and appreciation are my two things that I go to all the time. And I was thinking before we got on this call, when things are going really well, we can still go back into autopilot and forget to appreciate that things are going really well. And we start taking things for granted. And that's when we have some slips up. So I am grateful that it's a sunny day today. I was grateful that yesterday we had a thunderstorm, but it's all about what you're going to focus on. And it's easy to focus on things that are not going well, but it's also, you can work on focusing on what is going well too.
Yes, absolutely. And, part of being able to make that change, on focusing on the positive, can be start fundamentally, in a couple of different ways. One of them, just to bring it back to social relationships, is to look at who you're surrounding yourself with. And that was part of this article's point too, was, we're impacted by who, not only what surrounds us. And, sometimes if we find ourselves in work situations where we're surrounded by negative people, maybe we don't have a lot to change that. But when we step outside of work, we certainly can look at those relationships and maybe make some choices. Although that sometimes can be difficult because, maybe friends that we've had since elementary school, mm-hmm. or neighbors who are next door, easily accessible, are not, perhaps in that positive state. And so then maybe it takes a little more effort to cultivate, some of those positive relationships.
It certainly can, but it's still a choice. And at the end of the day, we can only change ourselves. But when we're in a work environment surrounded by negative people, what do? We focus on the fact we're surrounded by negative people. So we're helping create that too. So even small steps of, as you're going to work today's going to be a good day. Today's going to be better than yesterday. So when we start setting the table for it to turn around, those negative relationships at work, maybe one chooses to work from home that day, or they stay in their own cube that day and don't come and complain to you about things. So you can still energetically have an impact on other people, even if they're not ready to make changes for themselves. It's about you taking care of your own energy as well.
Well, and one of the challenges that people will often face with that will say, okay, well, I can tell myself as I'm going to work, today's going to be a better day, but I don't maybe always believe that,
Yeah.
And so, I think therein lies, the challenge. What advice do you give to people when they say, okay, well, I'm going to maybe start trying to shift that energy by saying that to myself before I head into that, work, or even, it can be a family dinner, or a family holiday where you might have relatives
Right.
and people who might be negative too. It could be a ton of different situations. How do you, like you said, deal with the fact that you might say that, but then, part of you doesn't always necessarily believe that.
And for me, it goes back to asking yourself if I believe that. And if I don't, then I bring it down a little bit. Like, I'm willing for today to go better. I'm willing to see the good in my coworkers rather than what they may be showing up as. So it's just really about what you're ready to see. Because if you're making an affirmative statement and then immediately your head's like, yeah, that's not going to happen, then it's not going to be effective. But if you start coming with things like, a lot of affirmations I use is, I'm in the process of changing my work environment, or I'm in the process of being healthier, or I'm in the process of, because maybe the actual statement I don't feel yet, but I can feel that I'm in the process of moving towards being a more positive person. And I think it also really comes down to self-talk on what we're saying to ourselves as much as what others are saying to us as well.
Yeah, and what I like to talk to, one of the things that I like to say, too, I think it's really hard for us, but I think we have to teach ourselves this is, past experience doesn't necessarily dictate future results. And I think we're very hardwired in our brains to say, okay, this is what happened yesterday. This is what, I usually sort of see, or this was my experience once before. And, we make the expectation that experience is going to, happen again. But, again, the brain fools us in perception, because memory isn't always, crystal clear. It's often, fogged with our own biases. And it's absolutely true. If you flip a coin, just because it was heads last time doesn't mean that it's going to be heads this time, Yeah, there's a 50% chance it will be, but there's also a 50% chance it won't be. But our brains are so wired to take the past experience and sort of lay it on top of the future. And that's where, we talk a lot about, not sort of setting, that expectation, because, things may then happen as you expect.
Yeah, and I think that's where we get into autopilot. And I would encourage people who are listening to, athletes for years and years and years have visualized the game before they get there. They visualize hitting the home run. They visualize the winning touchdown. And so they are pre-paving their day ahead of time. Most of us pre-pave our day ahead of time. It's like, oh, it's Monday, I've got to go to work. Oh, I'm going to have a bad meeting today. And maybe Friday you did have a bad meeting, so it's easy to expect that. But our thoughts are pre-paving our future. So the more we can, gentle baby steps towards what we want to see happen, the more we're going to bring that in. There's going to be challenges, maybe daily, maybe weekly. You never know when it's going to be, but that's also part of life. I really do believe if we did not have challenges, and we would begin to take everything for granted. So that's one of the things I do as well, is when I'm dealing with a challenge, I remember maybe it's a client that I've had that's challenging. The vast majority of my clients are easy to work with. I'm grateful. If it was a meeting that didn't go well, most of my meetings are really kind and helpful. We get a lot done. I'm grateful. So sometimes it's even using that challenge that I can't find gratitude for, but I can realize that everything else, or the majority of things around me, are working better.
Yes, absolutely. And sometimes we have to sort of check ourselves in the sense of again, that perception. One of the things that, we often talk about, and I'm often reminded by you, is to say that, that went better than expected. I mean, to take a few seconds, before you start your day and say, okay, if I am going to make this positive change, then okay, I'm going to think this way, and then that's going to create a change. And then, at the end of the day, you really look at it, and a lot of times we'll go, yeah, it really went better than I expected. And then if we kind of stop and see that happening a few times, and there's going to be days where it doesn't go better than expected, but if we see to ourselves that, most of the times it actually is, that helps to, like you said, reinforce, that, being able to talk to ourselves at the start of the day and being able to believe that, that belief that we're saying to ourselves, okay, today, this is going to go well.
Yeah, and I think what I like about the better than expected is it still allows it to, because if we know that the day ahead of us is going to be challenging for whatever reason, we know it's a meeting that we don't want to be at, or that we have to go someplace we don't want to be at, then by saying it went better than expected still allows it to not be perfect and rainbows and sunshine, because not every day is that. But it does mean that it was, even if it's just a little bit better than what was expected, then we grow more of that from that. And really, appreciation and gratitude is the best way to create more positivity in your life. And it's just like I was saying about athletes, they practice, practice, practice. In the coaching that I do, I tell people it's exercising your positivity muscle. It's no different than getting on a treadmill to get your cardio up. Affirmations, being appreciative is your cardio work for your positivity muscles.
Yeah. And in the realm of positivity and health, there is just so many studies and things coming out about how sort of having that outlook can really make a difference in our health. We often separate our physical body from our emotional body, but we really are finding that those connections are there. A lot of people talk about having a gut feeling, and anybody who's been under a lot of stress will tell you that they notice gut issues. And I get a lot of people who come to me for functional issues or gut issues. And I get a lot of people who come to me with, physical pains that they're feeling. And we often talk about, how, our emotional stress, which stress seems to be an acceptable, word, to say, but it can certainly be the whole range of emotions of anxiety, sadness, anger, and all of those emotions as well, besides just sort of this term of stress, physically, affect the body. So, but all those emotions, again, sort of are created in our brain for, in a sense, their emotions, when they affect the whole body. But our perception of whatever creates that sadness, that anger, can change, and that can change that emotion. There's the whole field of cognitive behavioral psychology, places that, at the foundation. So it makes sense that, being positive, can create longevity in the sense of, those emotions that are negative. If we can, not necessarily ignore them, or we don't want to suppress them, but we want to acknowledge them, and then sort of try to reframe them in a sense, because oftentimes there's a lot of either hurt or fear or something in the past, again, that's triggering them.
Right. And I think it's important to realize you don't have to forget the past to move forward in a happier state of mind. Like, our emotions, the ones that are heavier as far as anger and frustration and fear, they serve a purpose. And the more we pay attention to it and actually thank them for showing up, because it means we're not feeling good. And if we focus on how we feel, I mean, I'm not an always or never, but I'm pretty sure the vast majority of people want to feel good. So if you're focused on this doesn't feel good, what will help it? And baby steps towards it. Sometimes you can do a grand leap if it's a small thing, but there's often big things that are going on in our lives that, and it could be a health scare that takes more work and more diligence to feeling good. And I think as we age, just by our experiences, like I can even think about experiences that happened to me that I would never want to relive, but because of that, I am who I am today. And so knowing that I made it through that big, massive challenge in my life, I know that I can take those tools into new challenges that come up, and hopefully not as massive as the ones that were in the past. But it really is about how you choose to move forward. And choices aren't always easy, but they are always possible.
Yeah. Yeah. And when you talk, a lot of the, studies on anti-aging, come from talking to centenarians,
Yeah.
And so, there's definitely characteristics of centenarians, that, come through, and there's sort of a set of, emotional attitudes that are consistent among people who live to be 100, and gratitude, is one of them, for sure.
I think gratitude's probably the biggest one of them. And I think what's so interesting is people forget that you can go through challenges and still be a positive person. Like being positive, it's been for so long that people think that you're a Pollyanna and that you're living in a pretend reality, and that's not what it is for me, and that's certainly not what my coaching is about. But it is about facing whatever is going on in your life, deal with it, but focus on the appreciation in it. And truly, when you think about it, even in those challenges, you can find things to appreciate. I have a family member who is, from health reasons, on oxygen 24/7. So that's an appreciation I have immediately, is I'm so grateful I breathe on my own. And that's something the vast majority of us take for granted because we don't have to think about breathing. Well, my family member does need to think about breathing. So it's just, even if you are in that big of a challenge, go back to the basics that we do take for granted.
Yes, absolutely, absolutely. And again, a lot of, like you said, to emphasize, it doesn't mean that people who've lived long lives have faced all kinds of challenges. I mean, they've seen a lot of their loved ones die and pass on. They've weathered, all sorts of storms. But the key, for them is, how to sort of, put that, into a larger perspective. And, in addition to gratitude, to bring it, sort of back to this, article that sort of sparked our conversation about positivity. It's also, about having, social relationships that are meaningful and being able to share. And I think sharing, is also a great, path to positivity, in the sense that if we have to sometimes get out of our own head, in a sense, and we can get really focused on what our own stressors are, what our own emotions are. And sometimes, not to take on other people's problems too much, but more in the sense of, looking at the larger community and being a part of some giving, or helping someone out who's a really good friend. That sort of gets us out of sort of our own headspace, which often leads to reframing, looking at our own life, and that leads to more positivity.
Well, and I think it helps too, as far as we realize that we're not alone. Like
Yes.
sometimes if you're going through a challenge, you think you're the only one who's ever gone through
Yeah.
it, or the only one who's gone through it to that level. And
Yes.
when you're able to call a friend or a loved one or go out and meet other people, you realize, everyone has their own challenges that they're dealing with. So the more that you can support each other. And one of the things that I encourage people to do when they are a giving person is to observe rather than absorb. Because if you're out there helping a bunch of people who are in really desperate situations, it's easy to bring that internally and feel down and things. But the more that you can observe it and do what you can to help and not internalize it, then you're going to be able to stay healthier for yourself as well.
Absolutely, absolutely. And I know a lot of people, again, struggle sometimes, with finding those, connections. If you move a lot for your job,
Yeah.
or your family has recently moved, because the spouse has had to change, an area because again of the job. If perhaps yourself are not maybe the most extroverted person. Maybe you're sort of more, introverted. I think there are ways that, I encourage people, even if you are, more to yourself and, you know, as we talk about introverts, they're not bad at all. I mean, I classified myself as one, believe it or not. But you tend to get recharged by quiet and solitude. But I would encourage people to still seek out, social relationships, because that's also important as well. And maybe that might be more difficult for some people. And so, I would say, to that, look, in sort of the how-to sense, don't be, it sometimes can feel like a big task and one more thing to do, but don't be afraid to just try a bunch of different things until you find the right spot, because you may, go to, whatever social gathering. I mean, we talk about going to a church function in a new community. You could talk about going to a, event or a social gathering, that you get invited to by a coworker or something. And, you may go to one thing and feel that that's not right, or that's not the right place for you. But just to continue to look, to find those, social relationships, because I think sometimes, there's a lot of concern that technology has sort of isolated us, in a sense. And we're social human beings and want to be, need to, in a sense, be a part of a larger picture.
Yeah, I agree. And I mean, the physical touch of being in person is important as well. But the one clarification I'd like to make between, because I'm an extrovert, and actually my network of closest friends, probably one of them is an extrovert, but the other couple are introverts. And what Dr. Sharyl just mentioned is introvert, really, there are shy people in this world, and that's a whole different thing. Introvert just means that you need solitude and alone time to re-energize. Extroverts need people to re-energize. You and I could go to the same party, talk to people, have a great time, and I'm ready to go, and you're going to need some quiet time. But at the party, both people would think both of us were introverts, or extroverts, I mean. So it really isn't about if you're a social person or not. You can be an introvert and still enjoy people, but you also need your own time. And I've worked that out with my friends, because I'm like, I need to talk to them right now when something's going on, and they need to process it before they talk. Where I process by talking, they process by not talking and then coming together to talk. So just find your tribe. And introverts, it does require more energy that you're going to expend to do it, but we don't need to have 5, 10, 20 close people. Even if you have a couple of people that you know that you can rely on, then that'll work. I was going to mention where you were talking about churches and different things. There's a great website called meetup.com, and it's a free website to join. And they have knitting groups on there. They have bicycling groups. They have all sorts of different common interests that you could go to and see if you could find your tribe that way as well.
Yeah, and I think, the reason why I think spending time on it, in this Facebook Live is important is because, I do think social relationships can lead to a more positive life. Now, bad relationships can lead, can be challenges for us. But we have our own biological family. We don't have a choice in, but every other relationship that we enter into, we have an absolute choice, and so we can create those positive relationships that will lead to that support that will help us live to be centenarians.
Well, and even our genetic family, we still have a choice. I encourage people, whether it's work relationships, family relationships, friendships, if they are people who are draining your energy because they're coming in with all their complaints or just they're negative by nature, then you can still, there's no reason to not love them, but spend less time with them. You can love them for who they are. If you try to change them, it's probably going to backfire unless they want to change. But just for your own energy, know if you're able to spend a day with them and not absorb their energy, or if it's just an hour. But you need to be responsible for your energy and let them do them.
Right. And don't feel, I think, all of us feel a certain sense of obligation, to, family members or groups that we're a part of. But we also have to allow ourselves and give permission to put, boundaries on those obligations. And that can be hard for all of us. It's going to sway and always going to change, based on what else is going on in our life and what else we're dealing with. But, again, like you said, just allowing ourselves to, take care of ourselves as we need to.
Right. And it is very hard to make those, especially like if it's dysfunctional family gatherings that you have to go to, or there's nothing you have to do, but we feel like we have to go to them.
Exactly.
So if it's something that you feel you have to go to and you're going to go to it, then give yourself some gentle care afterwards, like plan a massage or whatever it is, it's going to nurture you back for the energy you just expelled there. But it really is about taking care of your energy with that.
Right. Because I think when we don't take care of our energy, then that's where we fall into the less positive emotions, which then affect our body and affect our health. And also realizing that all of us have different energy levels. I mean, I do. Again, don't want to set that intention for somebody that they're low energy. But, I mean, some of us there are some people out there that can run, on a 14-hour day, 16-hour day and have no problem whatsoever. I mean, they don't. And then there are people who, run on an 8-hour day, and they need, sort of more recovery time and recovery time. And if you're one of those people, that is okay,
Absolutely.
To give yourself permission that you may not be able, you see sometimes a lot of the people who run, on higher level, being able to do a lot of things, in their day, but that's them and that's okay with them. Don't feel that you have to be that person.
We could do it. We could do a whole Facebook Live on health in comparison to other people. Because if we could stop comparing ourselves to other people on a multitude, whether it's we're comparing how successful they are or if we're thinking that we're better than they are, the comparison tends to create havoc for us. So.
And again, it often is there's a lot of perception involved in that.
Yeah, exactly.
When we look under the covers, we often find that what we perceive is not necessarily reality for that person.
Right.
Yeah. So, to sort of kind of summarize everything here, we talked, how positivity can improve longevity, with gratitude and giving being, some of the core essentials for that. If you're looking to say, okay, I want to be more, I'm positive, but I'd like to maybe improve on that, or want to, what would be sort of the, things that you would say, hey, let's focus on to improve that positivity quotient in our lives.
Well, one thing I wanted to add to that is I am a very positive person. I've been doing this work for over a decade, but guess what? I have negative feelings. I get angry and I get frustrated, but I have tools that I don't stay there that long. But maybe Dalai Lama is positive 24/7, but I think the vast majority of us aren't. And I'm not fond of being angry. I have to admit that. But once I catch it, then I move forward back into where I want to feel. And I want to feel happy. I want to feel appreciated. I want to feel kind, and I want to feel compassionate and loving. So that brings me back into that space. If you're already positive, it's really simply just upping your appreciation and gratitude. I mean, when I take a walk, I am looking and smiling at the trees. Did you get it?
Oh, I think just my earphone must have come out. So yeah, go ahead.
So it's upping that for yourself. And also being gentle when you do step into not feeling good about what's going on, because that's just part of life. And you get to decide yourself. It looks like we're frozen. So you get to decide if you're going to stay in that space of feeling angry or feeling sad. And, when our loved ones die, we lose a job or any big event in our life, it's going to take some work to go back into that positive space, but it's possible. And I just encourage appreciation, appreciation, appreciation. Look at everything in your day and appreciate it. And that's going to keep you in that frame of mind. Helping other people. Now, when it comes to helping other people, it's helping them where they are, not trying to make them who you want them to be. Meet them where they are and see them in their full potential. But when we try to make people be happy and positive, it tends to not work so well. I can't tell you how many people want me to coach their boss or coach their boyfriend or coach their wife. And until they come to me, it's not going to be helpful.
Yeah. Can you hear me okay, Carol?
I can.
So I agree with you. I mean, I would add, and to bring positivity into your life is to, besides gratitude, would also be, doing a little self-introspection. I mean, I think we tend to be fearful about that, but because sometimes we're not going to, it's hard to look at ourselves, and we don't want to be one more person that criticizes us, but not in a criticizing eye, but just in a introspection and sort of look at our thoughts that we have or the emotions we have and try to take a step back and maybe view them as a third person and try to evaluate them. And that's with meditation, mindful practices, things like that can really help. Or journaling. That's another favorite of mine, to kind of take a step back and look at these things, because if we do, we often, that tends to be the groundwork for change.
Another good tool to use is just to put a couple fingers on your heart and take 3 deep breaths, but to connect back to your heart, because we tend to go into our heads and then not focusing on our heart, and our heart to have the feelings of it. Meditation, like you said, is definitely anything that brings you back into a quiet space for yourself. Meditation, people think it needs to be sitting quietly with your eyes closed. That is a form of meditation. Usually when you're doing something, like for me, when I'm sailing, I'm in a meditative space because I'm in full appreciation. So there's guided meditations you can do where somebody's talking to you and you're listening to that. You just try out a few different ways to see what works for you.
Exactly. Uh, Deep breathing, being mindful, um, meditating, prayer,
Yeah.
quiet time, taking a walk. Those are all synonyms for the same thing of, just trying to, take a step back and in a sense, not during those activities allow just us to keep thinking and thinking and thinking about our problems, but to actually, focus on that moment, and whether that's meditation and breath or word in meditation,
Right.
or being out, on the lake enjoying sailing. That's all just sort of, taking your focus away from, those thoughts in our head.
And I think what you mentioned about introspection, another aspect of it is when you're going through something that's challenging right now, how were you a month ago with it? Like if you've been practicing being a more positive person, a lot of times my clients, like they'll have a bad moment or something. I'm like, remember what you were like 6 months ago. This would have had you under the covers all morning long. And right now it's irritating to you. So it steps into it. So really also in introspection, notice where you're doing better than you had in the past and letting things go easier. I know that like octogenarians who are happy with they've had a process where they know that things are not going to go well or did not go well in their lives, but they have worked through it. And again, as this article mentions, having a connected relationship with them has helped them tremendously. I think as a Western society, we see wealth and being in the green as far as our finances as what's going to create a happy life. But in studies all over, some of the places are third world countries, people live the longest and are truly the happiest because they don't have that expectation of who they need to be and what degree they should have and what type of house they should be living in. So I encourage you not to put your job title as what is your happy place.
Yes, I agree. So, some type of introspection, applying, looking and applying gratitude to your life. And it's a great tool to use if you find yourself in a negative space. It's a great quick tool to get you there. Building, social relationships that are meaningful to you with no judgment as to what they should be. I think those are all those great components and places to start with positivity. Would you add anything else?
I think also doing some research just to find how other people have gone through situations. You had mentioned earlier about, octogenarians and what they focus on. One of my favorite mentors, he passed away a few years ago, was Wayne Dyer. And he had said it was almost as though his whole intent of this lifetime was to teach independence. And he grew up in a foster care system from 3 to 10. And so he went through some hard knocks to learn how to live an independent life to be able to help other people. Someone else could have victim mode for their entire life that they grew up in a foster care system. So you can take your challenges and those hard times in your life and make something of them. I'm a quote person and I use them in my weekly messages. And some of my favorite quotes are from Helen Keller. And what kind of life did she have? Yet she has the most positive move forward through your struggles of anybody. So you can have a challenge and you can rise above it.
Absolutely. And I think if the challenge seems overwhelming, I'd encourage people, to look, for a coach like you or a counselor, someone who sort of maybe help guide them that direction. You have a website, carolccmiller.com, for people who might be interested in, some of those types of ways of making change if the prospect of doing it themselves seems a little daunting.
Yeah, I think if you can get support from a friend, a colleague, a family member, or somebody professional, whether it is coaching or counseling, we tend to ignore if we have mental health issues, and there's so much help out there for people who are dealing with that as well. So if there's something that you can reach out and get some help that you need, you deserve it.
Absolutely. Absolutely. Well, thank you very much for joining.
You're welcome.
It's always great to kind of talk about these topics. It's amazing how, although the same themes tend to reoccur. So just a few upcoming things for those people tuning in. My practice, I'm Dr. Sharyl, Truty, owner of Balanced Physician Care. We're going to have some upcoming webinars. This time of year is a time of year where people are making a lot of healthcare decisions for the upcoming year, and we have sort of a unique healthcare solution. It's a membership-based practice, and it's not concierge medicine, although very similar. It's called direct primary care. We're doing a webinar next Wednesday at 7 p.m. That's October 17th. For anybody who might have heard about this and might have an interest of how this might, provide better care for them and their families, or at least another choice what is out there. So if anybody has ever been interested in sort of knowing the nuts and bolts of this, if you tune into the Facebook Live, please pass the word along that we're doing this upcoming webinar. And we will have some more in November and December as well. And you can check out our website, balancedphysiciancare.com for that. We also are going to be doing more upcoming Facebook Live presentations, and that'll be next month. Next month on November 8th, we'll be back at A Leaf and Bean, one of our favorite places in Jacksonville, to again talk a little bit about direct primary care and that membership for those that kind of are interested in a more one-on-one sort of conversation. And then you and I, Sharyl, will kind of be back the Thursday before Thanksgiving, which happens to be November 15th, and talk about one of our favorite topics, gratitude. It's a great season to talk about that and be reminded about that.
I'm looking forward to it.
Yeah. And so again, your website is carolccmiller.com, and you offer quite a bit of services for people as well.
Yes, I do group coaching and then individual coaching as well.
And they can find all about that on your website, correct?
Yeah. Mm-hmm.
And then I know you're founder and I'm part on the board of a nonprofit that is sort of based in Chicago, but has a presence not only all over the country, but all over the world. It's called Positive Focus. And so if you're just interested in trying to improve positivity in your life, I think it's a great place to start. We have a tremendous presence on Facebook. Thanks to you, Carol.
Yeah, come join me over on Facebook. It's Positive Focus. And again, the website's positive-focus.com, but you can find anything about it over on the Facebook page as well.
So it's another great place if you're looking for positivity and may not want to go into coaching, or it's a great place to have a community involved. So
yeah, I've been doing daily lives on different quotes about living your best life. So come join me. I'm usually doing it 11 o'clock, but I did a little early today so I could chat with you.
Well, thank you. Thank you. Well, thank you very much again for joining us today. Again, my name is Dr. Sharyl Truty. I'm owner of Balanced Physician Care here at the Beaches. I do a primary care and holistic medicine practice, and we do a unique membership-based practice as well as individual self-pay consultations and regular primary care. So if you're interested in any of or all of those services, check us out on our website, balancedphysiciancare.com, or give us a call at 904-930-4774. We'd be happy to chat with you. Thank you again very much, Sharyl, for joining us today.
Thank you.
Have a fantastic week.
You too. I love the back view of the palm trees and things. I'm in Chicago. I don't quite have that view, but it's still beautiful.
Thank you. We just had some storms blow past us, so we're doing pretty good here today. And thank you for everybody for joining us here today as well.